You know, I don't know what the CEO, Jeff Slovin, or the president, Mike Oggins, has to say about me using this next phrase, saving the best for last. But that's what I got to say.
We're definitely the best. I mean, what are you talking about?
If T-Bone is in the house with a side of mash, then you know that who's
I
saving the
brought my
best.
sidekick with me. I mean, I brought my
Nice to
brother
meet you,
from another
Mash.
mother, for God's sakes.
All bets are off, ladies and gentlemen, as we wrap up CEREC 30 with Meena Barsoum, T-Bone, Noah Levine, and Rich Rosenblatt. We
He's
are
short, by the way, just so you know. He's that chair is on stilts.
I actually I needed a step stool to get up.
I'm just letting you know.
we're breaking in the new guys on the finale. You know that's probably not going to end pretty, but that's okay. It's all about fun. It's been a remarkable weekend, and it's gone by in a flash.
Yeah.
But you guys are the focus, so let's get to it. DentalCompare.com. Mr. Levine, how about you starting us off?
Well, first of all, thanks a lot to Sirona for having us all out here. It's been a wonderful few days, and quite a lot was introduced and talked about throughout the last couple of days. And with 3 clinicians here on the panel, I really want to know which one of the many innovations that they introduced here has you most excited and why. And just one. I don't want to hear everything's amazing. So start to my left.
You know what? That new chair is unbelievable. I've never seen so many things wrapped up into one
Center.
piece of equipment. Center. You know, it is. It's a treatment center, and to be able to see all the hand pieces, the equipment, the CEREC machine all built in. I mean, to be able to clean your handpiece. I mean, that thing is unbelievable, and it's beautiful looking too. So that to me was one of the most impressive things I saw at the event this weekend for me.
For me, without question, is CEREC Guide 2. That ability to take the implant process chair side, $56 for a surgical guide, to save patients time, to save practice time, to save economics. No question. For an implant-based practice like myself, it's without a question the biggest thing.
And I think for me would be the software updates. 4.4 and Ortho 1.1 are really incredible improvements. I've been using Ortho 1.1 for a while, and it's really a big change in how it initially came out. So I'm really excited to see the new opportunities we can do with the new software.
So now you guys, obviously, you've all been using CEREC for a while. You know it well. It's a big part of what you do. But for dentists who are not into this yet, do you think any of the things introduced here is going to tip them over the edge? And what might get a new dentist saying, okay, this is for me now?
Well, I think at the end of the day, it's as Tony Robbins talked about, it's always a moment, right? It's how long it takes us to get to that moment. And what CEREC 30 has proved to me, okay, and I've been coming to from the beginning, is we started with 1,000 to 2,000 or 3,000 to 6,000 people, right? So we see the technology is growing. We see it's going there. I think the big thing is probably the realization that the technology works, and it's almost becoming mainstream, that we're moving beyond just restorations, the orthodontics, the implant applications. It's a turnkey solution for practices today. And I think that is what people should recognize that are non-owners, that this is the way forward. Sirona has a product that they're continually investing in and making great applications for us to expand our practices.
And I think when you look around, you have 6,000 rabid fans for CEREC around here, so it's hard for a new user not to get excited when you see these many people really, that bought into the technology, for a long time. And it's really contagious.
I talk about it all the time when I have to speak to people who are on the fence about wanting to work their way into come into the software. With the technology, I always say to them, it's the most pay-it-forward community. When you meet people and what we do in dentistry, you go to a regular meeting like a ADA or something like that, and people are just walking like heads down. They're trying to avoid contact with the booths. So, they don't want people. Well, that's fine. They're trying to I get that too. So. And you come to something like to an event like this, and everybody knows each other, or they recognize you from an event that you did or something you wrote, and they're come up and they're asking you questions, and the way we share amongst each other, there's no competition, and I love that aspect of and there's no part of dentistry at all out there other than what we do in the digital or in the CEREC world. Really, it's awesome.
And Okay, so you guys both just jumped ahead on some of the questions I had, which I guess shows that
okay.
everyone kind of had the same feeling here. We're all, we go to a lot of trade shows. We are there because we have to be there. Dentists go to them because they need to get CE. They occasionally want to talk to people in the exhibit halls. But what's different about an event like this? And, is this a better model?
What's not different about something like this?
Yeah.
I mean, you come here, you look in the exhibit hall, it's products that we like. They're not groping me, trying to get me to, to buy
That's
stuff.
not by mistake, by the
Oh, you think they don't? Oh, so you're telling me they don't want to grope me? Okay, that's fine. And from the educational events, I mean, the sheer number of educational events, how it's dialed in to what fits our practices, and not just clinical education, the personal education. Like Tony Robbins, 3 hours with Tony Robbins last night. You tell me where we're getting that, and then Emmett Smith, and just the overall the atmosphere is just it's electric.
Wonderful.
Yeah, I agree with T-Bone, and it's you walk around and you see so many people that you've just developed these relationships through the years. I mean, T and I have been doing this for
Long time, a bunch of years.
More than 4. I'm 12 years as a CEREC user, so. You develop these relationships seeing the same people, and it's amazing how many people are still in it, even from the rep side, they stay in the game because it's just such a great community.
And another thing to bounce off this, and I know T will back me up on this, when you're with a company that's so forward thinking, and just about the time you think you've gotten up to the latest technology, they're one step ahead, and you're constantly around that environment, and you're energized by that momentum, it's hard not to love it, right?
Yeah. I mean, I look at myself like I'm on the upper level of CEREC users in terms of my level of integration and what I'm doing with it. And I come here and I meet people like Rich, and they push me, right? And I get that. Okay, listen, I got to step my game up, right?
Right.
And when you're like you said, when you're around that, it's contagious, it's energetic, it's electric. You go back and you're just like, how fast can I go back and learn? And to have a company that keeps giving us innovations that grow our practice, you can't ask. I say that if you use CEREC and learn to use it, it's the only practice management tool you have to continue to grow your practice.
And Meena, you're nodding your head something fierce.
I feel like I'm at an Apple event. You come out, and every time you come to one of these, there's a new innovation that's just a major game changer. So it's exciting to be part of it.
Yeah,
For sure.
Now, T-Bone, you're obviously, implants a huge part of what you do, and that's been a big part of sort of bringing all these technologies together. You're now connected 3D imaging, CAD/CAM, all of that comes into one place. But does that become intimidating to the new dentist who's just trying to crack into it? And, how do they get started if there's so many pieces now and so much you can do?
It's a great point and question. I'm only into implants because of this technology, quite honestly. I failed at implants. I struggled at implants. I was non-surgically oriented. This technology really breaks down that barrier for you to be able to enter implants. And I think what I would tell general dentists out there is, if you're worried about implants, you don't have to jump in like immersively. You can jump in and pick and choose. I want to do single units on the posterior jaw. I want to do these things, and then continually expand and grow as the technology gets better. So for me, it is the gateway into implantology for the general dentist.
Yeah.
And I also, on that note, T, because I know you do a lot of work with your oral surgeon, and you guys, and what's really nice about the technology when we do it, we get to speak almost a different language to them than their everyday referrals. So even if you're not comfortable, I know where I want everything to be, and as somebody who's doing it, at least I can say, hey, I need the implant here, and then we just figure out, all right, here's where I need it. How do we get it there? Right. So things like that are really nice when you're talking about what you're doing with the implants, because I don't necessarily have to do it even if I don't want to at the beginning. But you can.
And I think that's what people miss. They think that if you get into implants, you have to do chin grafts and hip grafts and all these things. That you don't have to. You can just pick and choose what you want to do. Just pick and choose.
Absolutely.
Now, obviously, lots of new things, lots of new ways to approach treating people with this digital technology. But wish list time. Where do you want to see Sirona take this? What do you want to be able to do that you can't do today, even with all these innovations and new areas of practice?
Man, that's a good question. T's usually the one that's got like a list of
I'm going to let Meena answer this one.
I'm excited to see the integration between the 3D imaging and the CEREC kind of go to the next level, where we can, really take the jaw movements and translate them into the CEREC and design our restorations to truly match the condylar position and the patient's actual anatomy to make it even more dialed in. I'm excited to see that.
So you're talking about the virtual patient,
right?
Yeah.
Essentially, because we're taking the airway, jaw movements, function, implantology, articulation, restorative dentistry. I mean,
Smile
what's left?
design.
Basically digitize a person.
Yeah, a
into
face
computer.
scan.
Yeah.
We can get their face, their skin. I mean, what's left? So, yeah. I think what I'm looking for is integration, deeper integration, more time. I'm looking forward, and what we're trying to do in our practice is move towards one-visit implantology, to where we can virtually plan, and we can already virtually plan, we can already mill the guide, we can already place the implant. Now I'm looking, let's go ahead and pre-make our restorations based on that virtual plan. So I'm looking forward to the day that we can do one-visit implantology.
Absolutely.
In terms of materials, obviously there's a lot of technology and hardware here, but in the end, you got to have something that you're producing that's going to be, replacing the function of someone's tooth. So, where are we at with materials? And do people have enough options? Is there something for every case?
I love the materials aspect of what we do, and again, being kind of an OG, an old guard. When we started out, what was there? What do we have when we started out?
We had one material.
We had like two materials.
Yeah, we had Vita and Procad.
So now all of a sudden, in the last couple of years, we've had this explosion of the hybrid materials and like Celtra Duo. We have obviously Emax that sort of rules our universe. So all of these great materials out there, and now zirconia. So just trying for I think for the user base, and even the new user base that's trying to come in. The materials that are the successful, the long-term ones, the strong ones, that's what Emax brought. I think it really changed the patients or the new users wanting to come in because they knew stuff wasn't going to break. Now I think zirconia is like the new gold. So it's the aesthetic gold. It's strong. It doesn't break. And I think a lot of doctors out there are using it. So I think watching that materials or something like it that we can get super strong cement is where the next thing's going to go for us. I hope.
And I think it's both good and bad having so many materials because it can be overwhelming for a new user, but it can also be really exciting because you can find the product or the material that works best in your hands. So there's so many options. You're not just stuck with one or two things to work with, and all the options are really good. So it's nice having everybody working together to make better products.
What's really neat too, as when we talk about materials for us, is as a CEREC user, you're kind of your lab, and you have to know, like you said, you have to know your materials. And you talk to other doctors, and they'll say to you, "How the hell do you know so much about dental materials?"
First on TV.
Oh, I'm so sorry. So they just write a prescription, E2, PFM, whatever they write, and they don't even know what they're getting. They don't know what kind of ceramic. They don't know if it's translucent, and we have such a better understanding of that because we get to deal with it every day.
I'm seeing a lot of movement in the hybrid materials, the combination of ceramic and resins. These are very kind materials to the patient. What we're seeing are higher aesthetics, longer lasting results with these as well, compared to the earlier generations of these materials. And we're seeing materials that mill unbelievably crisp. The margins that we're getting with some of these hybrid materials are mill times being 5 or 6 minutes. I mean, I can mill a restoration in 5 or 6 minutes today. I mean, when I started with CEREC, it was 24 minutes. I mean, so we're cutting down to 6 minutes today, and with great-looking materials that fit impeccable. It's a great time to be in materials, and I'd like to see us continue to push the manufacturers. I like seeing this competition. I like seeing more manufacturers coming into the game because it's only going to change and keep pushing them all to develop great materials for us.
Yep.
Do patients know about this technology yet? I know that there's talk here that there's going to be the push
They will.
consumer marketing, but
Exactly.
do you find already that you have patients that are coming in, asking for this?
Those are my favorite patients when they come in and say, "Do you make?" Oh, absolutely! Before they even finish a question, they're in the chair and we're going. So it's it's exciting.
What I'm seeing is they're not using the brand name right now. What they're saying, I hear you can make crowns in one visit, right?
Yeah.
And I think with this marketing campaign that Sirona is doing with 1-800-DENTIST is we're going to see this brand recognition. And patients don't want, as much as you may think how great you are as a dentist, patients don't want to come to you more than they have to, right? We got better things to do. They want to save time, save money, all those things. So the marketing campaign will create a significant awareness for dentists and for patients.
Because I know for us, I brought my practice in 2007, and in 2008 the market crashed, and I had this huge note. I had a very small practice, and I thought I was done. I thought I was going to shut my doors, and I bought my office and my CEREC on the same day, having no idea if I had enough patients to even make it a viable option for me. And that machine is really what kept my doors open, because I'm in an area that has a lot of corporate headquarters stuff, and I would do something on somebody, and they were petrified to take off of work and things like that. So, yeah, they didn't necessarily know about it through marketing like we're going to do there. But the internal marketing, the patients would come in and say, oh, my, they would do the same thing. You got one visit crown. They didn't know CEREC.
They didn't know CEREC.
You can do crown in one visit. And I would get that coming in. So I think in my area, it was, I was the one visit crown guy in my town.
I would, if you don't mind, I think to me, and just thinking about it right now, one of the biggest testaments to this technology is the adoption we're seeing from the DSO organizations, because they're very, efficiency driven, and when they see that this technology works, it's efficient, it produces great results, and they can bring it into essentially very new dentists and make it work very well. It really speaks great to the technology and how wonderful it is.
Terrific. Well, doctors, thank you all very much.
That's it. I was going to stay for 30 more minutes.
Yeah.
Wow. Wow. Look at the time.
Exactly.
So sorry. No, and I said it before and I'll say it again. It's so refreshing to be around professionals who are so passionate and enthusiastic about their profession.
And professionals, I'm laughing on the inside so hard.
And you said it, I think you said it earlier about paying it forward, and thinking. We're always talking about thinking forward, but also paying it forward in the way that there's this camaraderie, this professional camaraderie. Anyway, guys, thank you so much for joining us.
Thank you for having us.
Thank you very much.
Thanks for being a great host this weekend.
Thank you.
Yeah,
You're very kind. I appreciate that, T-Bone. And, it's been a remarkable time. I have a few people I'd like to thank. American Orthodontics, Care Credit. These are some of our happy sponsors. Digital Enamel, Fortune Management, Isolite Systems, CEREC, ClearCorrect, 1-800-DENTIST, Vita, Comprehensive Finance, Dentsply, Ivoclar, Vivadent. Thanks to them, thanks to you guys, thanks to the facility here at the Venetian. I mean, it's been absolutely remarkable. It feels like it started off with this rock theme, and we all feel like rock stars, don't we?
Yeah, we do.
In our own way. Anyway, thank you for joining us. We're going to wrap it up and head on home, and looking forward to the next one, which, they announced this week, CEREC World, so we'll be in Orlando. Is it August, right? So
August.
The magic continues.
I'll bring Mickey Mouse.
Bring it. If anybody can, it'll be you. So live from Las Vegas at the Venetian, I'm Dave Temple, and all these great guys and gals here at CEREC 30. We thank you, and take care.